organizational meeting. At this time, I'll turn it over to our county attorney.
Thank you, Mr. Wiggins. We have two orders of business in the organizational meeting. The first is to consider the minutes for November 6th regular meeting and November 15th special meeting. Is there a motion to approve both sets of minutes?
So moved.
Second.
All those in favor say aye.
Aye.
All opposed? So the minutes are approved. The second order of business is to elect a chairman for 2024. Are there any nominations for the position of chair for 2024?
Mr. Chairman, I nominate Mr. Leonard Wiggins for chair.
Are there any other nominations? Is there a motion to confirm Mr. Wiggins as chair for 2024?
So moved. Second.
All those in favor say aye.
Aye.
All opposed? Congratulations, Mr. Wiggins.
Again, I'd like to thank the board for the continued support to serve as your chairman. It's an honor, and thank you so much. At this time, I'll call the regular,
Gotta get your vice chair.
oh, that is, okay. Is there a motion for vice chair? I nominate Reverend Hines.
I would like to nominate Commissioner Harris.
Any other nominations come to the floor? Hearing none, all in favor of Reverend Hines, please raise your hands. It's three. All in favor of Ms. Harris, please raise your hand. Ms. Harris wins the nomination for vice chair.
Appreciate the opportunity.
Congratulations, sir.
Congratulations. You switch chairs.
At this time, I'll call the regular meeting of the county commissioners to order. Mr. Evans, would you, safety instructions?
Yes, sir, Mr. Chairman. I'd like to call on Ms. Natalie Best, our Deputy County Manager, to give us our safety instructions.
To provide for the safety of those attending this meeting, please listen to the following instructions in case of an emergency. First, please take a moment to note where your exits are. If an emergency arises that prompts us to evacuate, please exit this room in a quick and orderly manner through one of the two doors to your right, and then proceed to the nearest stairwell, directions to which are indicated by the exit signs. Once you exit the building, we ask that you safely cross Granville Street, which is the street that runs beside our building, to our parking lot to be safely away from the building. Our staff will provide additional direction and assistance. In the case of a tornado warning, we ask that you exit this room into the hallway where we will all remain until it is safe to exit. In the event of an active shooter in the building, if there is an accessible escape path, please run and try to evacuate the premises. If you can't evacuate, please find a place to hide where you are less likely to be found and lock any doors that you can. And as a last resort, and only if your life is in imminent danger, please fight. Our staff will provide additional direction and assistance on what to do. Thank you for your attention.
Thank you so much. Reverend Hines, would you please offer prayer?
Eternal God, our Father, we give thanks for another day, for the life that you've given us. We ask that you'd bless our minds and our hearts. We might consider the things that will make our county a better place in which to live as we serve our citizens and offer them the opportunity to live in a county that's worth living in. Bless and keep us in your care for Christ's sake. Amen.
Amen.
At this time, scheduled appointments.
Yes, sir, Mr. Chairman. Tonight we have Mr. Dalton Barrett, who is our community paramedic supervisor, and he's here to give you an update on our community paramedic program. You'll recall that we are using our opioid settlement funds for this effort. This was a position that was created, I guess, about a year ago. I think is off to a really good start, and you'll hear more about that from Mr. Barrett.
Good evening, everybody. Go ahead and get the PowerPoint up. I've got some visual tools for us a little bit later on in the meeting. But I'm a kinesthetic learner and a visual learner, so if you're one of those, you'll appreciate what we've prepared for you all tonight. Also wanted to just kind of introduce myself. Like Mr. Evans said, my name is Dalton Barrett. I'm the Community Paramedic Program Manager. I was a road supervisor here with EMS for about 2.5 years, and then transitioned to a more traditional business, which would be like the 9-to-5 type deal, which I'm still kind of getting used to now. I've got a little baby at home, so it's been a good change for me versus working those 24-hour shifts. So I appreciate you guys for really kind of putting this thing in position before I even walked into the role. So without further ado, we'll go ahead and jump right into this thing. So I do have some conflicts of interest as I am a salaried employee by Edgecombe County, but I have no other disclosures for any other named partnering agencies or people in the presentation here. All of the statistics were either pulled from our data software that we use for charting on the ambulance, or it was pulled from the North Carolina. There'll be some references at the bottom, but most of it's North Carolina or Edgecombe County stats. So community paramedicine is basically a newer idea. EMS has only been around since the 70s in the U.S., but the community paramedicine idea is a little new, but basically it's non-traditional EMS. I ride on as you can see, the Tahoe up top, I ride on something other than an ambulance, usually by myself, and go into people's houses and treat them, and most of the time I leave them there. So it's a little bit different than showing up in the big box, throwing them in the back, and hauling off to the emergency room to seek further care. Most of the time I can handle usually more chronic issues at home, and that's kind of the design. As Mr. Evans pointed out, we're utilizing opioid settlement funds for our program, so one of the priorities for us will be the opioid use disorder population. That's kind of our priority, and it's a huge problem that we'll talk about also. So we did develop a mission statement, improving health by dismantling barriers, providing compassionate care, and integrating community-based support. Some of the things that we see on the day-to-day and interact with kind of in my job, we link them to stuff that's already going on in the community. So there's a lot of good work that's already being done. We're just trying to kind of navigate that patient to those resources. I put up a map of a couple of the other community paramedic programs that are in existence around us. Edgecombe, we're number one. We're out there in the middle. Ours is opioid settlement funds, and we have a substance use focus. Pitt County also has a program. You can see their vehicle in the top left, and a number of the other counties. What's interesting is that number 2 right there in the middle is a hospital-based community paramedic program. So their design is to keep people out of the hospital. So they want to kind of reduce their 30-day readmission rates that way. Basically, everything else is EMS kind of focused, including us. All right. So like I mentioned, we have a substance use focus. We're utilizing the opioid settlement funds. The North Carolina map that's up top, what's shaded in is the counties that are actually doing something with the money. So right now there's only, just over a third of North Carolina that's utilizing this money that has been trickling in since 2022, which is a little bit scary to me because, the need has been here for a while. The problem has kind of developed since the 90s, and North Carolina and Josh Stein were some of the main folks that had a hand in this thing before it started coming down, and only a third of us has really started using the money. So I'm proud to have Edgecombe County highlighted in that map, but that is kind of an issue that I see. We're supposed to get $4.8 million over the next, give or take, 16 more years. So the way that we're spending the money is kind of a trio, if you will. There are different strategies and things like that that you guys voted on. Number 3, the recovery support services. That's kind of what we're calling the CP program. That's kind of the budget that we've allocated for that. The Narcan distribution. So that's taking place through the health department. We're giving out Narcan on the ambulance in my vehicle as well. And we're working to put a vending machine in the sheriff's office that way that they have a stock of Narcan for both the deputies but also for those who are being released from incarceration, all right, if they're identified as having opioid use disorder or, even if they just want a box of Narcan because they feel they may need that down the road. And then number 9 would be the syringe service program. The health department was doing that through COVID. That kind of slowed things down. We jumped in and we're doing it on a mobile version, and basically what that is we're giving out supplies that are, needles, syringes, and things like that to kind of combat the bloodborne pathogen spread in Edgecombe County, which is a big deal. So we know that we're not going to really put a dent in drug use, but what we can do is give them a clean needle and a clean syringe. That way, if they've got hepatitis C and their friend who's doing drugs, they don't spread that bloodborne pathogen, which is a huge issue. So that's kind of the strategy with that. I've got a lot of literature that kind of backs up, why these things work and such. That'll be listed on the website. So just a quick story to kind of get everybody in the mood for this thing is we had a 32-year-old male. This was in late September, was released from a local jail, not in Edgecombe County. He overdosed in Edgecombe County on October 1st. And we went out to the scene. We reversed him with Narcan. I believe he went to the hospital, was discharged the same day, and about a week later he overdosed again in the same location. This time we weren't able to reverse his overdose, and he passed away. So there's a really, really kind of, black cloud statistic that we bring up from time to time that mentions post-incarceration, somebody with opioid use disorder is 40 times more likely to die than somebody without. So that's a big problem. So that's kind of the idea behind the vending machine and getting that into the community. And it's on order. I spoke to the representative today. They messed up the graphics, so they're having to reprint that thing, and hopefully it'll be coming down the pipeline soon. So we're hopefully going to prevent this from happening again. But that is a sad story that we throw in there because we think about, not in my backyard, right? But this was something that happened just a few months ago. And our heart goes out to the family if they're listening tonight or whomever. So where's the need? So obviously we mentioned the opioid issue is everywhere, particularly it's in Edgecombe County. EMS here has responded to 211 overdoses from January 1 to December 1. Our average response time from the call to checking on scene, so when you place the 911 call and the call is given out to EMS to a time the ambulance is arriving in the driveway is about 9 minutes here, which is not bad because we have 4 stations and we're serving just over 500 square miles, so that's a lot of road to cover. So what's the citizens going to do in those 9 minutes, in dealing with the overdose? And our hope is that we can get Narcan out to the community and they can really make a difference that way, because opioid overdose is 100% preventable, right? Opioid overdose death is 100% preventable. We did have 25 overdose deaths in 2022. ED visits, we see 77 at ECU Edgecombe. However, I would say about 60% of our county is seeking care at a hospital in somewhere other than the facility in Tarboro. So a lot of them in the south end are going to ECU Medical, or on the western side of the county or the northern end toward Whitaker's, they may go to Nash. So we don't see a whole lot of ED visits, but they're definitely there. And then last but not least, we see some of the bloodborne pathogen numbers there with HIV diagnosis rates per 100K and Hep C. So just to kind of put things into perspective, Charlotte, Mecklenburg, they're right there in the 21.3 category. That's overdose death rates per capita, basically. Edgecombe County is well over double that. So you can kind of put things into perspective there, because I think we see like the big cities and we think about the homeless populations and things, but we kind of forget about some of the same things going on here. So traditionally, first responders have really done a bad job at responding to this crisis, because we would get very frustrated with some of the repeat offenders that are overdosing from time to time. We'd get there, we'd give them an extremely high dose of Narcan and wake them up and put them into opioid withdrawal. So somebody who's been addicted to opioids for a period of time, we give them a lot of Narcan. It's basically kind of wiping that drug off of their brain receptors, and it puts them into almost like, you can kind of think about opioid withdrawal like the flu. A lot of nausea, vomiting, some anxiety, just kind of, feeling really, really bad. Everybody knows how the flu makes them feel. And the only thing that's going to make them feel better is to either use again or go on some type of replacement therapy traditionally. And then if they go to the hospital, most of the time the physicians are going to observe them for a couple of hours, make sure they don't overdose again or have a need for another dose of Narcan, and then send them out the drugs. And their discharge instructions is don't do any more drugs. And these folks are addicted to this stuff, and that's just not working. So what we've seen is a big stigma towards the opioid use folks out in the community with the healthcare system and first responders. So what are we doing to kind of change that in our program? So if you look on the board, that's a number of different things that we felt like we could offer the community, specifically the substance use population that would really kind of get towards some of the root problems and hopefully keep these folks alive to where they do get into treatment down the road. That's our hope. So number one, we offer medication-assisted treatment on my ride out in the community. So for that patient who gets Narcan and they're now on opioid withdrawal, we can give them a drug called buprenorphine or Suboxone and kind of alleviate those withdrawal symptoms. We have a number of other things that we can treat their withdrawal symptoms with as well. Loperamide is one, clonidine is another, and Benadryl and some of the over-the-counter medications we kind of link them to because they're going to have insomnia, they're going to have body aches and things like that from kind of detoxing off the drug. And this is a good way that we can help them and then get them into treatment. That way they're not having to kind of feel those withdrawal effects. We give out a whole bunch of Narcan in the community in those boxes. I brought one today. They're basically just lock boxes. And in these is a 2-pack of Narcan, a flyer for Freedom Hills Medication Assisted Treatment Program, a business card for our program, and then also a card for a Never Use Alone program, which is a program where if you're doing drugs by yourself, you can call this number. They'll stay on the line with you and make sure you don't overdose. And if you do quit responding, they'll call 911. So it's kind of a good program for those that are not quite ready to quit. So we give those out 24/7, 365. Initially it started just on my ride, but now every ambulance in the community here is giving it out. But also, one of the effects from an opioid overdose is the patient stops breathing. So that can be pretty tough if we've got a 9-minute response time, right? So what we're trying to do is if we utilize a bag valve mask device, which is something that allows the EMS professional to breathe for the patient, we'll actually leave that device with the family and kind of train them on the use of that device after we leave, if the patient doesn't want to go to the hospital or something like that. That way, in case this thing does happen again, they have more tools in their toolbox to keep them alive until we can get there, if that makes sense. I think it's been a really good way to kind of break that stigma that I talked about. Our folks are very excited about giving those boxes out and training in the community. We do a Narcan training. We had one with the recovery group in Princeville. That was well attended. That was in October, so that was a big deal. We don't mind coming out and doing some Narcan education if anybody's got a group that may be interested. Like I mentioned, we do the mobile syringe exchange. We also facilitate street drug analysis in partnership with the UNC Street Drug Lab. Basically what we do is we can go out to someone in active use that has drugs on them. We get a small scoop, we put it in a vial, no questions asked, it's sent off anonymously, and we find out exactly what's in it. I've got some pretty interesting stuff that y'all might, we'll dig into just a bit later to kind of talk about some of this current research that we've done over the past couple months about what's in the drug supply. And it's kind of shocking to me. We do a lot of referrals to treatment, whether it be peer support, whether it be primary care related. A lot of these folks don't have insurance or not currently under a doctor's care, so that's a big deal. We also refer to mental health professionals, and then lastly to the medication-assisted treatment folks. Most of the time they go to Freedom Hill. And then connections for social and environmental reasons. Most of the time, especially this time of year, if they're homeless, we try to link them up with a homeless shelter or with somebody that has, blankets and some type of food for them, different things like that, to make sure that all the needs are taken care of. So some of the interesting things, so talking about the UNC data, or the UNC Street Drug Analysis Lab that we kind of partnered with, back in September and October, we were able to test 5 different, I call them stamps, but it's like these baggies that have a stamp on them, and as you can see kind of in the bottom, that one happened to be prostitute, but there's different ones like Block Party and YouTube, and just, I guess that's how they market this stuff. And they're always kind of changing the stamp, and that's, I guess, kind of like the type of beer you drink, if you will. But what happens is that these stamps, the substances within those are different from batch to batch, if that makes sense. So back in September and October, we saw a lot of the heroin and fentanyl kind of mixed together, which is what we knew was out there in the field, is the traditional, heroin becomes, contaminated with the fentanyl, and it just really, it doesn't take much to overdose somebody off of that stuff. But what we found was that 20% of those samples had a drug called xylazine in them, and that's a veterinary tranquilizer that's not approved for human use. And basically what happens with that is it causes the patient to be even more sedated, but then it also causes these really nasty skin lesions that are very resistant to heal. So it's producing kind of some more chronic issues in the community. And specifically those that are homeless are having a hard time taking care of those wounds. And it's not necessarily where the person injects the drug, so it could pop up anywhere. So that's why it's very scary. This was something that we didn't know was here until we actually got out in the community and was able to, quantitatively say that it was here. Other things we found was fuel additives, chemical dyes, and a malaria drug was actually in the supply as well. Also, what we saw was some stimulants. I mentioned fentanyl was severely sedating, so these people have jobs, these people have families to take care of. So if they're on fentanyl all day long and falling asleep, that's just not going to work for them. So I guess what's happening is stimulants, whether it be caffeine or cocaine, is finding their way into the drug supply, and that's kind of counteracting the sedation from the fentanyl, which is very hard on your heart. Fast forward to November, we actually got this information on Friday, so I felt like it was important to share today. So we actually tested 2 different stamps. You can see a picture of the one on the bottom there. This is one was Block Party and one was prostitute. They had less heroin and less fentanyl in them, but there was a large presence of xylazine. There was 80% xylazine, or there was 4 out of the 5 samples that had xylazine in them, and there were large amounts. So back in September, October, the xylazine was just trace amounts, but now it's just as much as the fentanyl and other drugs in there. So this produces a pretty nasty trio. So cocaine, fentanyl, and xylazine. That's hardcore. So now that we talked a little bit about the problems, let's kind of speak to a little bit about some of the successes that we've had. We'll say, I guess since June 1st, we've interacted with 194 different people. So that's pretty cool. That's a lot of people in just a short amount of time. We've done 23 buprenorphine inductions in the field. The average dose of that was 16 milligrams. Most people start out on 8 to 16 milligrams, so that's about normal. So that's 23 people that didn't have to go through opioid withdrawal in that time. So I think that's a big success. We mentioned the xylazine contamination. We do know about 2 or 3 weeks ago, a patient had a lower leg amputation from a xylazine wound that they just couldn't get to heal. So that's a big deal for that person, right? They can't walk like normal just because of a contaminant that was found in the drug supply. We do mobile Hep C, syphilis, and HIV blood testing in the field just because we know that the IV drug user is at a pretty good chance to have something like that. So we offer that in the community for free. It's tested through the health department, and they're linked to care when a positive result comes in. 3 out of the 5 people that we did a blood draw on were Hep C positive. So that's 60% of the people we're testing, right? So that's a big deal. But the good part is that Hep C is treatable, and all 3 of those patients are undergoing treatment for that. And then lastly, that's some of the Narcan statistics that we have. Personally, I've given out 59 kits, and EMS has given out 19 after business hours. So those are the ones that happen overnight, because when the banks close, overdoses don't stop. So big thanks to the guys on the ambulance for kind of picking up my slack after hours. We do know that of those kits that we've given out, 5 of them have ended up in reversals. So they're being used. They're not just out there. They're being used. So a success story. So kind of going through the date here, May 26th, we were just getting our start. We started May 22nd. We weren't really seeing patients at that time. But we had a 36-year-old female patient who overdosed on opiates. She was taken to the hospital and discharged. About a month later, she overdosed again. This was in town. I was able to respond with the ambulance crew at the time of the overdose. We got there. We talked to her about the treatment options that we were, just started this program. This is the things that we're trying to do. Let us know if we can assist you. She refused transport, but I was give her one of those boxes. About a week later, she reached out to me via phone. She said, I think I'm ready to get into treatment. Contacted Freedom Hill. I went and met with her. An intake was done within 2 days, and MAT was started within 96 hours. So I think the intake was done on a Friday. MAT started on a Monday, so they're closed on the weekend, so that's pretty good timing there. She went off the grid about a week later. So Freedom Hill was like, this person got into care. They've disappeared. Can you check on them? So was able to track her down. She had gotten out of care because she was feeling those withdrawal symptoms. She was kind of going through detox. Wasn't feeling the greatest. We were able to kind of link her up some medications in the field, in her house, left her at home. She re-enrolled with MAT, and since then, she's been to every weekly recovery meeting in Princeville. She's been drug abstinent for 6 months now, and she attended the Narcan training on October 18th and said, we saved her life. That's pretty cool. Another success story. Our program doesn't just deal with substance use. We do a lot of other things as well. A lot of primary care, a lot of work with bedbound patients, folks that just need some access to health care. So we don't mind getting out in the community and doing a lot of different things. Got a referral from the EMS team for a gentleman out there in Rocky Mount with eyesight issues, high blood pressure, and he had no doctor. So we went out there and kind of went through our normal questioning and assessment, and we found out that he had a 52-year history of opioid and methamphetamine use. That's a long time. So it was probably poppy seeds back in the day. So we referred him to Freedom Hill for both primary care as well as MAT. They got out there and they were going to do a Hep C check on him just to see how he was. They weren't able to get a blood draw in the clinic. Luckily, that device on the right-hand side of the screen is actually a portable ultrasound. We were trialing that, just doing a couple of different things with it, but we happened to have that at the time he needed a blood draw. So we were able to go to his house, utilize the ultrasound in his home, do a blood draw, and lo and behold, he was Hep C positive. He's on treatment now. We check a blood test on him about once a month. Unfortunately, that was just a trial of the ultrasound. We don't have it right now, but we know what vein to hit. So we were able to kind of keep up with him. He doesn't let Freedom Hill do his lab work. He says only Dalton can do my lab work. So it's kind of a running joke between us and them. He's been drug abstinent from methamphetamine and opioid use for over 5 months. And methamphetamine is the hardest drug to treat in the field. So looking at this whole thing and kind of planning for the future, some of the things we'd like to get kind of going down the road that we feel like would help us is number one, a little bit newer vehicle, which is on order. So we're just kind of waiting on the state contract to come through with that. It'll be a Ford Expedition, so that'll be a nice ride. We need some radios to put in that vehicle. We'd love to get an ultrasound, which was that kind of thing that is over here on the right-hand side of the screen. It's wireless. It hooks up to your phone. You can do a whole number of different things with it. But most importantly, you can do those blood draws. The device in the middle, that's called an iStat machine. Basically what that can do is a number of different lab tests in-home. So we'd love to be able to test these people at home if they're not able to get to the clinic or don't have insurance and can't afford it or something like that. We can at least get an idea of kind of where they're at. And then the device here on the left side of the screen is a IV pump. So some of the things we've done in the field is IV antibiotics. We've done large dose Solumedrol for MS, kind of as an extension of physician offices and things when they have no home health to come in to do these things. If they're in a pinch, we don't mind going out there and helping out. But if we had a pump, a 2-hour infusion, we could potentially leave that patient, go check on another, and come back, and it still be, done safely. So that's some of the things that we're planning on getting in the future. Also, another staff member has been, approved and everything. We just have to get the equipment in to get them on the street. So I think we've got everything built out. We've got plenty of work for them. We get referrals all the time. So we're ready to go. We're busy. I hate to take a sick day sometimes just because I know the work just ain't gonna get done. But I've really enjoyed this program so far. I think it's making a difference. Partnership opportunities. If you know somebody in active use that needs somebody to talk to them, just need some support, scan that QR code. I've got some business cards, things like that. Call the cell phone, send me an email. It's really low barrier. I don't mind coming out and meeting with them and just kind of telling them what's out there. Or if they want to interact with Syringe Exchange, we don't mind doing that either. Training, it's kind of twofold. I'm a lifelong learner, so if you got some training going on you think I would benefit from, be glad to come and sit. If you think that I can train a group that is near and dear to your heart, be glad to come out and do that sort of thing as well. And then on the right side, we always need food, blankets, hygiene kits. That way if we're interacting with a bad situation, we have something to give them right then. We don't have to make a referral and, send them 30 miles from home to get something. We can give them something right then. And this is a quote I like to talk about just because I walked into this thing not knowing much about MAT, not knowing much about opioid use disorder. But I've got a lot of people in the field that know what they're doing. And my job is just to point them in the right direction, and I think we've done a good job with that. Be glad to answer any questions y'all might have.
Any questions?
Other than the vehicle, if Santa Claus were to come on the 25th, how much money would it take for him to get you the rest of that stuff?
We got a grant from East Point, so some of that stuff is in the works. But I think probably another $20,000 would really kind of get us off to a good start.
Would that get everything on that board you had?
I'd have to look and definitely make a Christmas list, but be more than glad to send that along.
Sounds like you didn't think about it right now, because Mr. Boswell might have some on his mind.
He's in a giving mood.
You don't delay that, okay? You got an idea?
I think 20K would be a good start.
I had a question. Now, you did say when they leave the hospital, there's not a actual referral directly to you or anything? from the hospital?
Most of the time what happens is, like, if we respond to an overdose, about 70% of those patients don't go to the hospital for those reasons that we mentioned, the stigmatized care usually. If our folks are dealing with some type of opioid or substance use related call, referral is made to me automatic. So whether they're taken to the hospital or released at home, our EMS professionals are doing a referral automatic. Now we have started kind of getting our foot into the hospital. We had a meeting with ECU Edgecombe this week about kind of our program and you know, our plans and things like that. And they're definitely open to doing some referrals as well. We did get a referral from Coastal Plain a couple weeks ago. So we're creeping out in the community. We've had some referrals from like concerned citizens. They call us, I heard about this program, and we were able to get up with them. So it's really, you know, just spread the word. I think that's going to be the best way to really kind of refer people.
Yeah, I would think the hospital would jump right on that because that's an opportunity to keep another non-paying patient from having to come right back.
Right. Yep.
Any other questions or comments?
I just want to make one comment, that is, God bless your efforts, and may we support you continuously. Thank you so much. Thank you.
But it seems, hold it. There's no questions at this time from them. But he'll be here when you come to public petitions. You can't answer the question. Can't answer the questions from the public right now. Any other comments from the board? But it seems like the board made a good decision, Ms. Evans, in setting this position up. And just thank you and all of EMS for what you do, okay? And it seems like, based on Mr. Boswell's statement, that, well, we're gonna get you fitted up, okay? Okay. Okay, we probably need those figures, okay? And you need to be out there, you need to be equipped. If you're serving the public, you need to be equipped.
That's right. I did want to tell you one thing, why some of the counties have not decided to utilize that money. Being on the state board, I've found out from other counties, especially smaller counties, who say they don't have anybody to run that program. They don't have the staff to have to do all those reports, because that opioid money has to be spent correctly, has to be itemized, and reports have to be done. And a lot of counties said they just don't have the staff to do it, so they have not touched that money.
And stay with us a minute, because we might have some other questions for you now, so, okay?
Okay. And I've got some things to pass out to you as well. We've got a brochure for our services that you can share with your groups, and then we've also got the drug results, if you're interested in that as well.
Thank you.
And I'll give you this before you leave. I just want to add my thanks to Dalton and the hard work he's doing. It was a team, including Michelle from the Health Department, Antoine, his staff, representatives from Sheriff's Office, who together as a group made the recommendation, this is how we should use those opioid settlement funds. And I thought that was a great recommendation. So they kick-started it. But as you see, the success of it depends on who's in that position, and we got the right person in that position. So he's doing a great job, and he's spreading the word. I've been in other meetings where he has presented and done a great job, and people are other groups are as equally excited about the work that we're doing here as you are. So thank you for that.
Do you have somebody else come?
Yes, sir, Mr. Chairman. We're fortunate to have with us tonight Ms. Joya Bullock, who is the district representative for Congressman Don Davis's office, and she would like to come and make introductions and share a little information.
Well, good evening, everyone.
Good evening.
Just want to thank you for the opportunity to be here. City Manager, Chairman of the Board, Commissioners, Attorney, City Clerk, Deputy, and victims of the audience. My name is Joya Bullock. I'm a Regional Director for Congressman Don Davis. I've recently been appointed to this position, so fortunately I've had the opportunity to meet some of you, not many of you, but I look forward to building relationships with all of you. I'm just going to do a brief congressional update, although I will be directly addressing the commissioners, but I will also be speaking to you all as well, so please don't feel excluded. And our services, assistance, and advocacy is available to everyone. Next slide, please. Oh, lovely. So Congressman Don Davis is working for the East within his congressional district number 1 here in North Carolina. There are 19 congressional districts. Of course, there's Edgecombe County, Nash County, and the Tri-County area. What we do focus on here in the district, our offices are located in Greenville. We do congressional casework. So what congressional casework is, we have personal and private relationships with our federal agencies across the country, and we serve as an advocate and a mediator between those federal agencies. For example, IRS. We've had many people call into our office needing assistance. They have not yet received their 2023 tax returns or the 2022 tax returns. They're unsure why. They have made several calls and they can't get through to anyone. Automated service, press this number, press that number. You're impatient, frustrated, the line disconnects. So we have been able to help facilitate the release of federal taxes and funds to constituents within the district. We're here for that. For example, we have many veterans in our district that would like an increase in their benefits. Maybe they have gotten a disapproval letter. Maybe they need more information. Maybe they're unsure of what to do and how to do it without the necessary technologies. We act as a liaison for that, and many other federal agencies included. So Whether you want to speak to the congressman directly or work with our caseworkers, we have been able to solve over 1,000 cases within his short tenure as congressman to help alleviate those frustrations and delays of dissemination of access and funds. So we focus a great deal of work and attention to casework. We do tons of constituent outreach. I think you all are used to getting tons of flyers in the mail of this and that, and you look at it and it's catchy and it's colorful and there's a logo, and then you toss it and throw it away, and honestly it's a waste of money and funds and paper and resources. Instead of doing that, the congressman has allocated his funds to appointing regional directors such as myself, Chris Hardy, maybe you have met, and our district director, Kimberly Mack, to do constituent outreach. What we do is we go out in the community, we serve as proxy, we represent him at events and opportunities where he cannot be. Much of you know, we've had quite a fun recess time in D.C., and the congressman has spent majority of his time in D.C. and not in the district because of the lovely camaraderie amongst his coworkers. So in place of him not being able to be here in the district, we serve as a proxy for him. We serve on and provide opportunities for congressional educational opportunities for our youth. I will be presenting an award to a high school student originally from Nash County who has served and provided over 500 hours of volunteer service for their county and nonprofits in the area. We like to acknowledge them because the youth are essentially the future. We also provide accommodations and greetings, fly requests, federal grant assistance. For example, there are an influx of USDA farmers, agriculture workers, and advocates who have a delay in funds. We try to alleviate, again, the delay in the dissemination of funds and try to expedite that dissemination of funds. So we really try our best to stand in the gap on behalf of the congressman, and those are his main efforts to work for the constituents of North Carolina's 1st Congressional District. Most of our direct district contact includes town halls. We've hosted several town halls to get direct feedback from farmers for the NDAA bill and the Ag bill that we're hoping to extend beyond January. We have hosted several telephone town halls. One specifically and most recently was the Israel and Gaza conflict. People were able to call in, ask questions, and to even challenge his votes and stance on certain issues. He makes himself available to express that feedback and opinions because it's necessary when he's representing us in D.C. We also host listening sessions, roundtables, tours. We have a newsletter that you can subscribe to as soon as you go to the website, which is www.dondavis.house.gov, and that keeps you up to date on all the happenings in D.C., any new legislation, any introduced bills, or any upcoming grant dissemination or funding or upcoming issues that you all would want to be aware of. We do texts and calls, virtual seminars, community service, and outreach. So when I say that we do our best to really be of service to the community and the constituents here, trust me, I might greet, host, and attend 4 to 5 events a day across the district. Again, it's 19 districts. So again, when he's not here, he does have those proxies and those people on his behalf to make sure they are working hard for him when he is not around. Just a brief legislative update. That's current. He is the vice-ranking member on the House Agriculture Committee. As many of you know, no matter what they say in Charlotte or Raleigh, agriculture is a really, really large source of income for our individuals here, and it's very, very important that he introduces fair legislation that considers rural communities. Oftentimes, we get underrepresented, underfunded, and overlooked when it comes to funding, the dissemination of monies, millions of dollars, and policies as well. So he's fighting hard for rural communities such as Edgecombe County. He's introduced, this is a little dated, but 10+ pieces of legislation. He serves as one of the highest ranking bipartisan freshmen in the House. And what we mean by that is whether you're red or blue, pink or purple, fat or skinny, tall or short, we all have to learn how to work together and find a common ground. And regardless of his affiliation, gender, or preferences, he has ranked 85th, which is top 3 in all the House members of his willingness to work with others across the lines, red or blue. And if no other time we need that more in the world than today. So me personally and professionally, I'm proud to represent a congressman such as himself. He's co-led 21 pieces of legislation, and he is the Democratic co-chair of the Agriculture Labor Working Group, which I mentioned previously. He's working hard for the House Armed Forces Committee Quality of Life Panel to increase the resources and the dissemination of those funds, resources, and benefits to our veterans and our armed forces members. When it comes to our short-term spending bill, he has consistently voted against the government shutdown, and he has voted for a continuing resolution or a brief bill to extend our current budget and acceptance, so the monies continue to extend and there's not a halt in government funding or sources that can essentially affect 6,700 federal workers, 46,000 veterans, and 174 seniors here in North Carolina's 1st Congressional District. Again, as I mentioned, with the Appropriations Committee, he has voted against a government shutdown, so we can extend the fiscal budget beyond December 31st, and those funds extend. When it comes to community project funding, not that he has been the one directly approving these grants and loans, but he has been assisting. We have provided MOUs, provided letters of support when it comes to the grants of, for example, $3 million that have gone to Nash, Wilson, Edgecombe for Head Start and Early Start. They'll be expanding their program to not only reach 3 through 5, but they'll start to reach infants. And a lot of you know child care is very important, especially since the pandemic, especially early child care for infants and families. There is a $100,000 grant going to the Speed Volunteer Fire Department. There's also been about a $682,000 going to the Murdoch Webbing Company to offset solar costs for municipal funding and the daily costs. There's also been about $7 million to go to the Innovation Project, which strengthens our education network for public school teachers and administration. So honestly, everything goes full circle. Now we do casework in the office. He's fighting for us in D.C. He's proposing legislation that supports the lives, livelihoods, children, families, and seniors and military families, Congressional District 1. But also we just try to be there as a community support. Sometimes, things aren't as grave or as serious. We like to participate in 100th birthdays or the anniversaries, just to highlight those remarkable achievements on the floor. For example, attending a 100th birthday and giving a congressional record in a church on behalf of Miss Lucy Pearl the other week. He'll also go to the House floor and share that same information in D.C. It's recorded to live forever, and then we also share that information. So any special moments, the birth, the retirement, the inductions, just anything noteworthy, we love to participate in and highlight that, not only in the county or the district, but across the nation, especially in D.C. Now, there's several opportunities to keep in touch and to stay abreast to the happenings in the Congressional District 1 and what's going on in D.C. He has a Twitter. We often post photos and links to particular businesses, events, and opportunities that we participate in across the district. There's a Facebook page and also Instagram. Depending on your social media savviness, there's plenty of opportunities to get involved. I personally look at Facebook. Outside of my job, I look at Facebook, but I'm not much of a poster, but it's a really good way to stay informed and abreast of the happenings in the district. This is the homepage of the website. As I mentioned before, you can certainly subscribe to the newsletter. It's dondavis.house.gov. The first thing that will pop up will be the opportunity to subscribe to a newsletter. You can go take a look at the issues. Many of his issues include education, jobs in the economy, agriculture, most importantly, and healthcare and the expansion of healthcare. So you'll be able to find out what exactly he's fighting and advocating for in D.C. by clicking on the issues. The services, that tab is where I mentioned doing congressional casework. If you're not much of a talker, a little introspective or antisocial, you can certainly go online and fill out a form to request casework. Again, we predominantly work with the IRS, Department of State, for example, we had many people over the summertime wanted a rush passport for a trip or a wedding or a family reunion, and you have a 6 to 8 week wait time and extra additional fees, and not a lot of people in the community know the free services and advocacy that the congressman and his office staff provide on a daily basis. So there's an opportunity to go online and request casework. Again, we work a lot with the Veteran Affairs, Department of State, USDA for farmers and members in agriculture. And there's a list of all the upcoming happenings and any new legislation that has been introduced. We only have one office out of the 19 counties, again, which is located in Greenville, North Carolina, again, which is the reason why he has regional directors to go out and facilitate in the communities. And then he has his one office in Washington, D.C. At any time of the day between 9 and 5 o'clock, you can call that 252-999-7600 number, and there will be someone to assist you and follow up with you in a timely manner. I have my personal business cards for you all. If I can assist you in any way specific to this county, this district, or any of your personal needs, I'm here to offer my services to you in any way possible. And we're just here to just inform the public of what we do, what we've been doing this year since he's been in office, and how we can continue to help and serve the constituents here, not only in North Carolina Congressional District 1, but especially in Edgecombe County. Any questions?
Any questions for Ms. Bullock?
Glad to have you in the district. Look forward to working with you.
Thank you so much. Looking forward to it.
Well, I'll just say, we'd like to thank you and Mr. Trey Lewis. We had a meet with Mr. Evans and I had a meet with both of them from Senator Tillis's office and Representative Davis in reference to the property, school property, the federal property that we had an issue with, close to $1 million, and just to say, it was resolved. We got a call and from Mr. Lewis saying that the issue was resolved, so we'd like to thank you for your work on that, okay?
Absolutely. Glad I could be of service. Thank you, and I will be here after the meeting to disseminate my business card and to assist in any way for the board and the constituents of Edgecombe County. Thanks again.
Thank you.
Thank you. Thank you. Other petitions?
Yes, sir.
We're now open for public petitions. Anybody here, please come forward and state your name and address for the public record. I do think we have some members that registered.
Yes, sir.
Go ahead. Go ahead.
Dr. Tracy Phillips indicated she would like to address the board.
Please come forward.
Good evening.
Good evening.
In examining the state of Edgecombe County, the prevalent property rates stand out as a significant social determinant affecting the well-being of its residents. According to the 2020 U.S. Census, the county's poverty rate is alarmingly high at 22.4%. This issue is compounded by the fact that 21.2% of the population is over 65 years of age, and a distressing 33% of children in our county live in poverty. The recent revelation from the county social services director that approximately 5,400 people, or about 51% of our residents, are eligible for Medicaid expansion adds another layer to this complex problem. Disturbingly, Edgecombe County ranks 99 out of 100 in North Carolina counties for health outcomes reflecting both the length and quality of life. We're at the bottom. These troubling statistics underscore the impact of historical and current policies. Adding to the distress, despite these challenges, Edgecombe County residents bear the second highest property tax burden in the state. This, of course, disproportionately affects the economically disadvantaged, exacerbating the struggles of those already facing financial hardships. Over the past 2 decades, the county has witnessed a decline in population, health, and overall well-being. The apparent lack of responsiveness, willingness, or concern from our career county leaders has contributed to this decline. Even recent initiatives, like the Get Off the List campaign, seem to be more symbolic than substantive, lacking meaningful action or communication with the community. It is a shame, as community engagement can be a potent force for positive change. It involves partnerships and coalitions that can mobilize resources, influence systems, and bring about environmental and behavioral changes. Unfortunately, the county's recent efforts have fallen short in this regard, raising questions about transparency, resource allocation, and whose concerns are genuinely being considered. Amidst the holiday season, it's crucial to remember those in need. This Christmas, as we revel in festivities, let's not forget the impoverished in Edgecombe County. Beyond the consumerism, there are families without food or medicine, individuals starting anew, and hardworking citizens struggling to make ends meet. Addressing persistent poverty requires a catalyst for change. It demands a shift in priorities and a commitment to transparency and effective communication. With this vision, I'm excited to announce my candidacy for Edgecombe County Commissioner, District 1, as I believe in the power of citizens to bring about effective and significant change. As we reflect on this season of giving, let's not only remember the less fortunate, but also pledge to be the agents of change our county so desperately needs. Thank you.
Thank you. Anybody else?
Yes, sir, Mr. Chairman. We also have Ms. Crystal Anderson, who's requested to speak.
Good evening, everyone. My name is Crystal Anderson, and I reside in Edgecombe County in Rocky Mount. I came to speak today. We're undergoing a demerger. Typically, when I come and I advocate at the school level, and I talk directly to those that are involved. However, my children are no longer in the public school system due to incidents that have occurred within the school system, so now we pay out of pocket for school, for them to be in private school. But I wanted to bring to your attention that as we're going through this demerger, that you guys keep in mind of the things that have been occurring within the Nash County Rocky Mount system to the children on the Edgecombe County side of town. There are a lot of schools that are dealing with issues when it comes to violence, when it comes to drugs in the school systems, when it comes to just everyday things that should not happen in our school systems. So I want you guys to just be mindful as we're demerging that there are going to be some additional services that are going to be required for our students on the Edgecombe Rocky Mount side of town when it comes down to mental health services. So as we're looking at our budgets, we're thinking about things, I would like for us to be proactive because we've lost a lot of advocates in the system, a lot of parents that have been tired of the education system and tired of the things that their children have been experiencing. They've pulled their children away from the school. And now that we're demerging and we're going back, that there are a lot of parents that just refuse to bring their kids back into the public school systems because they are unaware, they don't know, and they are fearful of the safety for their children. So as we're going to this demerger, I would ask you guys to take a more proactive approach, more hands-on approach, especially when you're working with the school board and the health department, because they're going to need additional resources within those schools. They're going to need mental health services. They're going to need additional officers in there that can actually communicate with them and try to curb some of the things that we're seeing that's happening within our school systems. And so I come before you as an advocate for the children. I no longer have children in the public school system, but I'm a mother. These children still interact with my children. And the things that are going on, you guys need to be aware of, okay? Thank you.
Thank you. Is there anybody else to speak?
Good evening, Camilla Stanton. First of all, I want to congratulate the chair, the election of the chair and the vice chair. Congratulations. I want to thank the opiate team. I hear a lot about the opiate issue in Edgecombe County, so I appreciate that team forming. Sound like they're doing some good things, and I look forward to it. Maybe I can get into some of the training. The spokesperson for Congressman Don Davis' office, and she talked about the IRS. I can relate to that. My dad didn't get his checks for about 2 years, so I went to Wilson and met with at that time Congressman G.K. Butterfield office, and we got the checks. I wanted them too because I wanted some of it. So it was good to me. And then I want to thank the board for all the hard work you all have done along with the school board. I told y'all last week at the meeting, the work y'all have done on the merger. I think you're coming a long ways. And I know there's still some issues that may have to be sorted out, but I think we are on the right track. I like it that the children will be going to North Edgecombe. That school been down there for a while, and at been some times they were talking about closing it. So now maybe it'll get back to where it used to be, because I travel the county, recording sports and stuff. So I appreciate y'all work on the merger. Thank you.
Thank you.
Is there anybody else here to speak? So you had a question, maybe?
Yeah, I want to commend the gentleman on his presentation, but he mentioned, something sticks with me. He mentioned vending machines or dispensing machines. Because is it free, or if it's not free, how much?
There'll be no cost.
So they're dispensing. Okay. The term was used as vending, that's what
And I didn't intend to stop you, but it's just we didn't take questions at
I
that time.
understand.
Okay.
I totally understand.
Okay. Is there anybody else here to speak during public petitions? Hearing none, moving on to other business, consideration approval of budget and services.
Yes, sir, Mr. Chairman. You have there budget amendments, a few for your approval consideration, a few for information. I will note that budget amendment number 1 regarding the increased funds for the urgent repair program, I'll ask that you hold that. That will come up at agenda item E. Budget amendment number 2 is regarding appropriating some additional funds in the maintenance department. I'll ask that you hold that. That is connected to agenda item B. Agenda item 2A, which was added at your seat. And what this is, you'll recall when you appropriated $1.7 million to accommodate the increases per our compensation plan overhaul. In that ordinance, you approved that they were put in one place. You approved in that ordinance that they will be allocated to the appropriate salary lines. What we did not think about at that time is that some of these funds going into the health department actually will be transferred from Fund 10 to Fund 12. So that was not captured. So asking that you approve, this is not additional appropriation, but transferring those funds from Fund 10 to Fund 12. Also, as an additional one at your place, Budget Amendment 2B. That is within the, below the level that is approved by me, so this is for information, but just wanted to point out, this is to appropriate funds for registered deeds for a renewed contract for their document scanning and digitizing project. You know, for some years, we've been appropriating funds so that those, her records can be scanned, digitized, and uploaded, available online. She's been able to do X number of documents every year. With the renewed contract, she will be able to, Ms. Viola Anderson, our registered deeds, her staff will be able to finish that process between this year and next fiscal year. So this will be to appropriate from that line $18,000 to her appropriate line. So at this point, I'm asking if you would consider approving budget amendment number 2A.
Is there a motion?
So moved.
Second.
Questions? All in favor, let it be known by the voting sign aye.
Aye.
All opposed, hearing none, 2A is approved. Go ahead, Milton.
Thank you.
Anything else?
No, that's it
That's
under
the
budget.
only one that we need to.
We'll come back and approve a couple of
The
them.
least budget amendments I've ever seen.
So what?
It's the least budget amendments I've ever seen.
It's a vote. Okay, yeah.
I know I thought someone was
He's getting smart, okay?
We'll bring extra next month.
No, he's learning how to do it, okay?
in the papers.
Item B is regarding acceptance and maintenance of Edgecombe Industrial Incubator. Rocky Mount Edgecombe Community Development Corporation, or RME-CDC, owns a facility at Fountain Business Park called the Edgecombe County Industrial Incubator. It is a 40,000 square foot facility that used to have both large anchor tenants, including a call center for the North Carolina Department of Revenue, as well as small businesses. The facility is now vacant, and the CDC wants to sell the building and reinvest the proceeds in Crossings at 64, their mixed-use development in Rocky Mount. And for those in the audience may not know, if you're coming out of Rocky Mount towards Tarboro, it's the last exit there on Riley Road, I believe it is, and that's where there's a Bojangles there and a new Checkers there, and a dialysis center behind it. The plans for that full development include some housing behind that commercial development. That's the development done by Rocky Mount Edgecombe CDC. The availability of this facility comes at an opportune time for us. It is well positioned for the county and our partners, including Edgecombe County Public Schools, Edgecombe Community College, Turning Point Workforce Development Board, and Carolinas Gateway Partnership, to jointly repurpose the facility into a workforce readiness center focused on manufacturing, engineering, and technology. You'll see there on the screen is a picture of the front of the building for those who may not have seen it. In addition to the work all our partners are currently doing, this additional effort is needed to meet existing and future workforce demands, especially with our prospects at Kingsborough Industrial Park. We are fortunate that there are state funds that will allow us to acquire the building without any county appropriation. Edgecombe Community College received a state appropriation that was to be used to equip the training facility we were going to build at Kingsborough Industrial Park. As you know, that facility was put on hold indefinitely once Triangle Tire backed out of their plans for the manufacturing facility. Therefore, Edgecombe Community College stands to lose those funds. However, with the help of Representative Shelley Willingham, those funds have been repurposed and now can be used for the purchase of the facility. Considering what a tremendous asset the facility would be for us and our partners, and that no county funds are needed to purchase it, I recommend that we take ownership of the building. If you agree, I also ask that you approve the accompanying budget amendment to appropriate $25,000 to cover utilities and maintenance for the remainder of the fiscal year. I want to direct your attention to the screen. You'll see, and basically this is just building out some thoughts on a concept of how this facility can be effectively used to provide career exploration opportunities, to provide career preparedness opportunities, and also career connections. That is, once the high school students, even it could be made available to adult learners, once they've had opportunities to explore careers, and then to be prepared for those careers, then to help them make connection to those careers. And so I think that it's a wonderful facility. If I think most of you have probably seen it. It's still in really good shape. As I mentioned, it's 40,000 square feet, and I think it will serve us well on this. I've had extended conversations with Dr. Andy Bryan, our new superintendent, as well as Dr. Greg McLeod from the community college, and both of them are very excited about the opportunities for this. I know Mr. Norris Tolson, who's in the room, he's had the opportunity to see it as well and join us in some of our conversation recently about the repurposing of this building. What I'd like to do is show you a very short video, and what this is the Martin County Schools, what they call their innovation campus. They took what was a retail space in Williamston and repurposed it to something similar to this. And I just wanted you to see that there will be how a similar idea could work in a similar facility. So I'll let you see the video.
On our side, Caitlin Richard shares what the new building will house.
Martin County Schools Innovation Campus is getting ready to welcome students. This is the start of many new opportunities here in the community. The community came together for the ribbon cutting of a new 60,000 square foot project. This facility has been in the works since 2016. The Innovation Campus will serve as an extension of both Riverside and South Creek High Schools for career and technical education courses. Many of the courses offered will serve as gateways to community colleges. It will also help students get prepared for work right here in the area.
The building was originally created for high school students in the fields of career and technical education. We are envisioning bringing students as young as pre-K in kindergarten, elementary and middle school to do STEM and STEAM activities here in this building. So just the sky is the limit with this new facility.
Starting in January, courses in North Carolina's business and health science pathways will be offered. The first courses will be health sciences and business education. After the first semester, the courses will just keep building.
I think it is definitely a good opportunity for the younger kids coming up and for our future generation to be able to, attend a facility like this.
School bus transportation and meal service will be provided for all students who need it. The $7 million Innovation Campus received funding from MC Commissioners, Local Capital Outlay Fund, and Public Schools Capital Building Fund needs-based.
I mean, there's so much here, and we've invested so much in this facility. It's going to really open their eyes to all the possibilities that are out there in terms of a career.
The people at Sunday's ribbon cutting say they can't wait to see what this facility will mean to students as they prepare for their futures. In Williamston, Caitlin Richards, 9 on your side.
So, Mr. Chairman, my recommendation is to approve the ultimate acceptance of ownership of this facility and to approve Budget Amendment Number 2 that will appropriate $25,000, excuse me, for the maintenance of the facility for the remainder of the fiscal year.
I'll get a motion on it.
I make that motion.
Okay, we got a motion and second?
Second.
Chair seconds. Questions?
Now, when you say cover the utility and maintenance for the remainder of the fiscal year, are you talking, that goes to what, June?
June 30th, yes, ma'am.
Any other questions?
Is this going to be maintained by Edgecombe County or Edgecombe County Public Schools?
For the time being, I'm asking that we take ownership and maintain the building. Once we have the opportunity to work out the details of the partnership in the building, we may decide it be owned by either of the two, or we maintain ownership of the building.
Do we have an idea? Is there upfit costs in this?
There likely would be. Currently, of the state funds that's available, excuse me, there's $2.5 million. $2.3 million is offered for the building, so the remainder, $200,000, will be available to do some upfit.
I think more than likely it's going to require some upfit.
Ultimate build out.
Right, depending upon what the use is going to be.
How much up? That was part of the question.
I called Mr. Evans the other day when we talked about this, and I'm not against this at all, don't get me wrong, I'm for the project, but, every time we take on another building, we take on a lot more expense, and it's more than what's here. By the time you figure additional insurance and other things, and again, I know everybody knows this, but I'm in favor of the project for sure, but I think, we need to be realistic about what we have to spend, especially when it comes to the budget.
Any other
Still
questions?
I'm
Anybody
still
else?
disappointed that the Employment Security Office moved out of there. All the way in Nash County, and my citizens, some who don't have transportation, are unable to get to where it is now. Is that a possibility coming back?
I don't know. It'll probably take a little bit of politicking beyond me. But.
And I would say not right now. There's no way, because they're probably on the, I don't know how long the contract that they are under, and so I don't see it coming back anytime soon.
Oh, the other thing was, now I know CTE with the high schools and community colleges together. So the Is community college going to be relieved of the CTE?
Oh, no, this is not to
Are they
take,
going to work together?
yeah, this is not to take over anything that either the community college or the school system is doing. It's really to create a facility where together they can work together in a facility and this facility be made available to them. This will complement and supplement all the things that each of them are doing, both in the schools and in the community college as well.
My last question. So why was that taken off the table then as the possible site for the ninth grades in 2024?
That would probably have to be answered by the school board or superintendent. I know one of the concerns, I do know this, was that to have that building ready to receive those ninth graders between now and the fall of next year, really the summer of next year, was just too tight of a timeline. And then considering not knowing whether or not it would ultimately be used as a high school, you would have to spend a lot of money, and then if you didn't end up using it as a high school, then it will be, some work to have to be undone, really. But ultimately, I think that they would have to answer why they did decide not to use that. And I will say, I'm always, concerned and hesitant about having to take on additional facilities. The difference here is that we have this really golden opportunity to get this facility, to purchase the facility without the county having to appropriate some funds.
The other thing I thought about, the Boys and Girls Club, Tar River Region, is working on almost same kind of facility, but now that they've purchased, that they have given the armory, and they're planning to do workforce development for youth. I just want to make sure that we're not all trying to build our own programs and not going to bring these programs together. Okay.
Yeah, and I agree. I totally, there's no need for us to work in our separate corners and not work together. It's part of the approach that we're pushing for getting off the list, is bringing those partners to the table and being more collaborative. I do believe that there is enough need out there where both facilities could function and provide some benefit.
Any other questions or comments? And the motion was to accept ownership and
To agree to accept ownership and to approve budget amendment number 2.
Is there a motion?
I think there was a motion.
There was a motion. Okay. All in favor, let it be known by the vote sign aye. Aye. All opposed? You opposed?
Yes.
Vote 6-1. Okay. Next.
Item C is regarding your regular meeting schedule for this coming calendar year. As you had indicated at a previous meeting, you'd like to move your meetings up from 7 p.m. to 6 p.m. So you have the proposed schedule there for you. So I recommend that you approve that. I do, ahead of that, want to point out that our ordinance, that the section that talks about Section 2-56, talks about your meetings, specifically notes that the Labor Day meeting is to be at 7 p.m. due to Labor Day being the first Monday of September. And so, as you know, we typically, if there's a holiday on that Monday, we have been having the meeting on that Tuesday. But our ordinance specifically says that it's to be pushed to that following Monday. So I recommend that you approve the schedule as you have here. Separate motion, I would suggest that you call for a public hearing at your January meeting so that we can make text amendments to our ordinance here. We want to make sure that our ordinance is consistent with your schedule.
Well, but the ordinance also gives us the authority to change in the meeting, doesn't it?
The ordinance says that you're to set your regular meetings at the head of the year, which that's what you're doing. Then you can amend that, but it has to be amended through a board approval, so.
And I think through our conversation, we have agreed on this time frame. Anybody got any other suggestions in terms of time frame? Are we satisfied here?
I'm satisfied with that. If we're amending the time on the ordinance, can we just amend that to the Tuesday? Because the town meets on the second Monday.
Right.
So it would be nice not to have two meetings within 5 blocks of each other at the same time.
We can certainly do that if that's what the board would like to do.
School board also meets on second Monday.
Makes sense.
The school board does? Yeah. So it seems kind of everyone has their time set out already. It would be nice to not overlap.
So the suggestion is, what was it again, Mr. Vaughn?
Following Tuesday after Labor Day, correct?
I guess the suggestion would be if we can't meet on the first Monday, to push to the next to push to Tuesday for the
Tuesday,
holiday.
the next day.
It's what we already do.
That's what we do, but it's not written in the ordinance.
Right.
I guess,
You better get that.
maybe my understanding of the ordinance is different. Because my understanding of the ordinance, regardless when we set the schedule, we can always motion to set another date. We can change, we have changed for 20-some years, okay. Any meeting that, go ahead, you.
No, I don't disagree, Mr. Chairman. I think Mr. Evans is referencing that highlighted section, 2-56A1, that specifically said the September meeting would be the Monday after Labor Day. So when we were discussing this proposed schedule for next year, we didn't want it to be inconsistent with the ordinance.
Go ahead.
I think what Mr. Thorne is suggesting is that we change the proposed schedule to the Tuesday after Labor Day and the ordinance to the
Right.
Change the.
Change both.
Change the proposed schedule for next year for the September meeting to September 10th, the Tuesday.
The 10th or the 3rd.
Okay, so
It would be the 3rd.
Right after.
Okay.
September the,
Thank you.
September 3rd.
And then
And change the time to 6 p.m.
that subsection A has two references to 7 p.m.
Right.
give me a motion to what you're talking about.
I guess the first,
That'll clear all of that
I
up,
got
okay.
a question before we go any further.
Go to
Can
the
first
can we-
motion would be-
Can we adopt it when we're already breaking the rules? We
Yes,
gotta
sir.
change the rule first.
Well, we are authorized by statute to set the schedule of meetings for next
Okay.
year.
Gotcha.
Okay.
So the first motion would be to change the meeting time to 6 p.m., correct?
In the ordinance.
Or just accept the schedule as is.
Yeah.
Accept the schedule as is.
we have to have a public hearing to change the ordinance.
Okay.
So I guess the first motion would be to call for a public hearing at your January meeting to consider this change in the ordinance.
So moved.
Second.
Questions?
Second.
Questions? All in favor, let it be known by the vote, say aye.
Aye.
All opposed? Hearing none, and that's done.
And then the second motion would be to approve the meeting schedule as presented, except with the change of the September meeting being September 3rd, which is a Tuesday, at 6 p.m.
Motion? Second? Questions? All in favor, let it be known by the vote, say aye. Aye. All opposed? Hearing none, so moved. We made that hard, didn't we?
Fixed it next year.
We made that hard.
January.
Our
Next.
attorney's gonna make sure we all.
Next, Mr. Evans.
Excuse me, next is the reappointment of Ms. Lewis as our tax administrator. As you know, we are required at least every 2 years, no more than 4, to appoint our tax collector and tax assessor. Ms. Lewis being our tax administrator, she serves as both. And so I recommend that you reappoint Ms. Lewis as our tax administrator.
Motion?
Motion.
Second.
Questions? All in favor, let it be known by the vote, sign aye.
Aye.
All opposed? Hearing none. Now we've got it done, it's just a question. Okay. The board appoints the board appoints the tax.
Yes, sir.
Okay. We'll let you do it so far. Okay.
Well,
You bring it to us.
I hire, but you have to officially.
Right, yeah.
Right,
Okay,
appoint.
okay.
And I do want, just for the record, for the public here, the recommendation in my memo was that be a 4-year term, and I just want to make sure that was
I read, okay.
clear, okay. I do, just as a reminder, congratulations.
Yeah,
As long as you don't retire within that 4 years.
it sounds like he can't fire you unless we do it anyway. Okay.
I can retire in 3.
Okay. So you don't want this to happen no more. Let's clear it up. Go
This might
ahead.
be my last one.
Let's clear it up. Go ahead. Go ahead,
I'm sorry,
Mr.
she needs to be sworn in.
Oh, did she did this one? Come on.
Place your left hand on the Bible and raise your right. Do you solemnly and sincerely swear that you will support the Constitution of the United States, that you will be faithful and bear true allegiance to the state of North Carolina, and to the constitutional powers and authorities which are or may be established for the government thereof, and that you will endeavor to support, maintain, and defend the Constitution of said state, not inconsistent with the Constitution of the United States, to the best of your knowledge and ability, and that you will not allow your actions as tax assessor and tax collector to be influenced by personal or political friendships or obligations. So help you God.
I do.
Congratulations.
Thank you. I appreciate your continued support, as always.
Thank you.
That was much better than getting sworn at one.
It is a little different.
Go ahead.
You get that every day.
Just as a reminder, the board, you who serve as the Board of Equalization and Review will be convened at our April meeting and to be adjourned at the May meeting. Depending on the number of appeals we receive and how many of those ultimately need to come to you, we may have a need to call an additional meeting or meetings, depending on the body. This is a reval year, so as you know, we usually get a greater number of appeals than normal, so.
And when did it actually start? Reval.
Oh, it has already started, so the.
Right. So we're currently in revaluation, and you guys adopted the schedule, I believe, at our last meeting. The appeal finalized Monday for the schedules itself. And then we will be doing our audit checks and stuff for the point forward. Notices are anticipated going out the first week in February. And then there'll be an informal appeal. And then, of course, anything that comes in that we don't adjust or they don't agree to, there will be another appeal period that will come to the Board of Equalization and Review, which will convene April 1st, or the first Monday in April, excuse me. Once that's done, we normally, we have the statutory authority to extend it longer during a revaluation period, but I choose to leave it open for our standard time just so we can have time to finalize any appeals and get the finance department and the county manager good values for budget time. So with anything like a Lowe's appeal that we had several years ago, something that large may affect that budget. So for the purposes of appeal, we only keep it open 30 days. The last year's revaluation counties were experiencing about 10% of appeals of their parcel count. We have 33 to 35,000 active parcels, and so 10% of that, you're looking at about 300. I'm not sure how many of those will come to Board of Equalization and Review this time, or if we'll have that many, but it's anticipated by our office.
I need to ask you a question. A citizen had asked me, if their house is immaculate, they keep the yard immaculate, da-da-da-da. Neighbor over here on this side has got, the house is trash everywhere, da-da-da-da. Does it take, and on this side, across, does that take the value of their home down
So,
in the neighborhood that they live in?
Our practices are a mass appraisal, so pretty much it is done based off of the neighborhood and the location and the type of home, as well as the square footage across the board. And then when reviews are being done by the revaluation team, then additional adjustments will be given based off of the outside appearance of the home. So they could have additional obsolescence based off the appearance on the outside, but in the same aspect, they may have it immaculately redone the inside, and we don't know that. So we do depend on the taxpayers to review their documentation and encourage them to check it out, look at their property record card when they get their appeal notice, and anything that does not appear correct, just contact our office. We'll be glad to do an on-site visit to make sure everything's accurate.
How often do you get people who actually come and say, I redid the inside of my house, I added 2 bathrooms, and I did da-da-da-da-da?
You'll be surprised when they're trying to sell it, they want every penny to match.
I know I had to do that.
So we do get a lot of realtors that are listing. If the taxpayer goes through a realtor, they automatically check out our information on our website. If we have it inaccurate, whether it be, I had someone not too long ago that had 2 bedrooms, 1 bath versus 3 bedrooms, 2 baths. And if anybody does appraisal, they know bathrooms make value. If you, not a bedroom, but bathroom. If you have a bathroom, it makes a difference. And so the realtor advised the customer to call us and let us know that it was wrong. But I have some personal relationships with realtors in our community that even if it's inaccurate on the taxpayers, I mean, on the tax office's side, he's like, in other words, you have 2 bedrooms and they went in and done, added 2 bathrooms or anything that would make an adjustment, then he will shoot me an email and say, hey, look at this property. My taxpayer's telling me I have 3 bedrooms, 2 baths instead of 1 bedroom, 1 bath. So, you know, it's just a communication thing between the public and my office, and we appreciate all the work that the citizens and the realtors do in our community.
So you let the tax assessor in when you get ready to sell.
I recently had a text from a friend that's in Virginia that said if anybody's lost, let them pitch a tent in the woods, the tax collector will find them. So I thought that was interesting. But that's pretty much true. If you can't be found, I will try to find you for sure.
So, but if you change a bathroom, it's still a bathroom?
It's still a bathroom, yes ma'am. The only thing that affects is your effective year wear, and what that is your depreciation and your remodeling. So instead of you're sitting in a 1976 bathroom or, you know, not updated tile, faucets, things like that, it'll bump it up several years to allow less depreciation, you know, to bring the value up some.
I know I called now before I did. Before my daughter did it. Okay.
Thank you.
Thank you, appreciate it.
Moving on, go ahead.
Next is regarding our urgent repair program. We were notified we're going to, available to receive an additional $65,000 in our urgent repair program. I recommend that you accept the additional award by approving the funding agreement amendment and the project ordinance, amended project ordinance.
Motion?
How much you say?
We're getting an additional $65,000. We had already received $67,000.
So moved.
Second?
Second.
Questions? All in favor, let it be known by the voting sign of aye.
Aye.
All opposed? Hearing none, it is approved. Next.
Item F is regarding Edgecombe Schools' application for lottery funds. Edgecombe Schools plans to provide repairs, roof repairs at Bullock Elementary, Carver Elementary, North Edgecombe, and Phillips. To use these funds, the Board of Commissioners, you must jointly request the release of the funds along with the school board. The school board has already taken action to approve the enclosed applications. I recommend that you approve the applications as presented.
Motion?
So moved.
Second.
Questions? All in favor, let it be known by the voting sign of aye. Aye. All opposed? Hearing none, it is approved. Next.
Presented for your consideration is an updated memorandum of agreement with NC State University for cooperative extension. The MOA describes the nature of the relationship and our respective responsibilities for hosting and supporting cooperative extension here in our county. A summary of the changes from the previous agreement is provided. These changes are improvements in clarifying the provisions of the agreement, but there are no substantive changes to our relationship roles or responsibilities. I recommend that you approve the MOA as presented.
Motion?
Motion.
Second? Questions? All in favor, let it be known by the voting sign of aye.
Aye.
All opposed? Hearing none, it is approved. Next.
And I'd like to say thank you to Ms. Tanya Heath, who's here tonight, and she and her staff do a great job, and we're very happy about the good working relationship we have with Cooperative Extension. Next is regarding use of state funds in the Health Department for staff retention. Our Health Department is receiving $264,835 in funding from the North Carolina Department of Health and Human Services through the Public Infrastructure Local Workforce Program. The intent of this program is to hire, support, and retain staff in local health departments. Ms. Etheridge, our health director, is recommending we use these funds to help retain staff by providing a one-time bonus, which is an eligible use of the funds. Considering the increased turnover we've experienced in the health department in the last 3 years, I agree with her recommendation and believe this will help with retaining staff. I recommend that you approve using these funds from the NC Department of Health and Human Services to provide a one-time bonus of $1,000 for full-time staff in the health department and $500 for part-time staff members employed on or before June 20th, 2023.
Motion? Question?
I have one question.
Go ahead.
On page 2 of the agreement where we were highlighting, it says there's a new something specialist position in the margins. This is just, we're just voting on a bonus. We're not voting on a new position.
That's right, just the bonus, that's right.
Any other questions? All in favor, let it be known by the voting sign, aye.
Aye.
All opposed? Hearing none, it is approved. After this, the releases for review and approval. Anything to be brought to our attention, Mr.
No,
Evans?
sir, Mr. Chairman, happy to answer any questions that you might have.
Is there a motion to approve?
So moved.
Second. Questions? All in favor, let it be known by the voting sign, aye.
Aye.
All opposed? Hearing none, it is approved. Review and approval of contracts. Anything to be brought to the board's attention, Mr. Evans?
Yes, sir, Mr. Chairman, I would like to share that the first one with RL Architecture PLLC, this is basically the second phase of our contract with this firm. We went through request for proposals process some months ago. They were selected. The initial work that they've done, the initial contract, was for the needs assessment and preliminary concept for our new animal shelter. This amendment will transition their work into the full design, bid specifications, and contract oversight. Our plan is to try to have this out for bids, if not before the end of December, shortly after. So recommend your approval on that. The second one is with Production Painting and Decorating. This is for exterior repair, cleaning, and painting at our courthouse. This is a planned project and is budgeted in our CIP for current fiscal year. And so I recommend that you approve those two now. The other ones need some separate action.
Motion?
So moved.
Second?
Second.
Questions? All in favor, let it be known by the voting sign, aye.
Aye.
All opposed? Hearing none, it is approved.
The next one with the ES&S Express votes. This is for the replacement of ADA accessible voting machines, requesting your approval of the contract as well as approval of this as a sole source procurement. This is, you'll probably remember that State Board of Election, they vet companies statewide. They make selection of a company or companies. This is the company that was selected. There's a letter included in your agenda packet that's verifying this is sole source. So I recommend that you approve the contract with ES&S Express votes for $89,785 as a sole source contract.
Motion?
So moved.
Second.
Question?
Is that paid for by the state or is that paid for by
That's
us?
county funds. And what we
Is that in
do,
our appropriation?
it is.
Any other questions? All in favor, let it be known by the voting sign, aye.
Aye.
All opposed? Hearing none, it is approved.
The next one for COT Systems. COT is the company that does the scanning of documents for our Register of Deeds office. This has been an ongoing project where we budgeted some funds each year to do a certain number of documents to be scanned, digitized. This is an updated contract with COT System, and so this will push them to completing this project in next fiscal year. I do ask that this is below the $50,000 limit, so I can approve this. I do ask that you approve the related budget amendment, which was budget amendment number 2B, to appropriate those funds to that budget line.
Motion?
So moved.
Second?
Second.
Questions? All in favor, let it be known by the voting sign, aye.
Aye.
All opposed? Hearing none, it is approved.
And lastly, you have a contract at your seat. I asked if you would consider adding this. This is a contract to, we have our heat and air controls, virtual controls in just about all of our buildings. I believe this will be to add the last of our major buildings to the system. This will be for our social services office in Rocky Mount. The amount is $39,320, and asking that you approve this as a sole source contract, and that being that Siemens Industry already has the system in the rest of our buildings.
Motion?
So moved.
Second? Questions? All in favor, let it be known by the voting sign, aye.
Aye.
All opposed? Hearing none, it is adopted. Last contract,
That's it for contracts, yes, sir.
review of departmental reports and review of anything to be brought to the board's attention?
No, I would like for Ms. Barfield to come and give you your monthly financial update.
Good evening, Commissioners.
Good evening.
I'm happy to answer any questions you have about the financial reports. I did want to highlight just a couple of items or bring to your attention. The first is the sales tax. I am happy to report that what's reflected in this report are the taxes collected across the state and county for July and August sales, which were distributed to us in October and November. Sales tax dollars are trending upward from last year for the same time period. Reviewing the North Carolina Association of County Commissioners sales tax estimates, it shows that trend continued to September sales, which we should get next month. That's up 8%. So far, these upward trends are exceeding what we have in our budget forecast, so we're real hopeful that this will continue and potentially we can use less fund balance as we get more sales tax funds. You'll notice if you look a little bit further down, the sales and service and fees, that's up for this time of year due to us selling our interest in the mental health building in Rocky Mount. We received $2.2 million, and of course, as you know, you voted, we reinvested 47% of that into buying cars for the sheriff department. So unless you have any other questions about the report, I'll give you an update on our audit situation.
Any questions?
We have completed, all of the field work has been completed for the audit. We have sent them all the information that they've requested. We're currently drafting the financial statements. They are every day sending us a few additional pieces that they need. We have been working really hard to give them a quick turnaround. Although I don't want to be held to it, we have been told that we're hopeful that by this Friday, no later than next Monday, that we'll actually have a completed audit in our hands.
Well, we need to call a meeting or?
I would suggest, once we know we have it, that you do call a meeting, though you technically don't have to review it before it's submitted to the LGC. Really would like for you to have it before you and be presented to you before the end of December, so.
Well, we really like to have it before. Okay.
I have a question.
Go ahead.
Have we made sure that we have checked that those same issues that were highlighted the last time do not exist? Like some of the things with DSS were recurring from the last audit. Are we making sure those are checked off? What was on there not appearing will not appear on this audit? Because last time it's like, these are the same issues we had before, why they were never cleared up.
I think you may be referring to the compliance piece of the audit, and while I don't have any concrete information on any of the compliance findings as of yet, and may not till later this week, I will just add that a lot of times, even though they may be recurring, you got to think about the staff turnover and training, so a lot of times those things get missed. As far as the compliance for programmatically, I probably have to defer to Ms. Battle in terms of what training she's supplying to the workers to ensure what's needed in the record is in the record.
The compliance is based on the audit, right? The auditor.
There's a physical compliance and a programmatic compliance, and a lot of the compliance findings at DSS were programmatic.
So I'm going to say we're going to have, in every audit, we're going to have some compliance issues.
Potentially.
The issue is we got to correct them. So I think they are going to be reoccurring because it's an auditor coming in and they're finding things that staff might have missed, okay? And so I'm going to say they can be expected, but I think the issue is what we have done, what we do about it in terms of responding back to LGC. So they will be there. I don't think there's no way to have a compliance audit and there be 100%. Okay, they're gonna pull some holes to define some issues, okay? So I would say the issues we corrected and send it back to LGC. So my position, they're gonna be there, so we can look for it.
And I would just add, really to reiterate what Ms. Barfield said, that I know Ms. Bauer has worked very hard in light of the turnover, the considerable turnover in the Department of Social Services, to train staff, for those staff who are there who are somewhat seasoned, to work very closely with the newer staff to train them. And so I know I've seen that and just heard that in the reports. They've been working very hard. Because that's the key component of it, is training staff growing to know the program. For example, Medicaid is probably one of the more difficult programs to take and process an application. And you'll hear, really across the state, professionals in the area say it takes at least 2 years for an employee to be able to process an application well on their own without very direct. And so when you have high turnover, it's hard to get that experience in, but they're working very hard.
Now, HR is HR under you?
No.
Okay. But anyway, have we made sure that we only have insurance being taken out for active employees, and that we are not paying any employees who no longer work for us?
We have gone back through that list after that item came up, and all of those who are still on those have been removed. Staff is more closely monitoring that as new employees come in and employees leave to make sure that we don't.
I remember those two items.
Yeah.
All right.
Good question.
Any other questions from the board? If not, thank you. Thank you so much. Manager report?
You'll see I have some information there. This is a monthly update that we're providing for folks who've expressed interest in the work that we're doing with getting off the list. But part of that monthly update is here with us. As you know, you're gracious to allow us to add a position to our team called the Career Navigator. That position is intended ultimately to help us to bring down that high unemployment number that we have. And the goal of the position is to identify directly Edgecombe County residents who are unemployed, meet with them to bring them into case management, to find out what their barriers are, and either get them connected to a good job or get them connected to training and resources so that they can get a good job. So you allowed us to create that position. We went out and received actually a lot of applications, and I'm proud to introduce to you tonight Ms. Tracy Putty. I'm going to ask her if she would come up to the podium. Ms. Putty just started last week, I believe it was, and she is off and running out there, meeting the agencies and organizations that she'll be working with to get referrals and building up the program. So I want to introduce her. And Ms. Putty, anything?
It is nice to meet you all tonight, and it is my pleasure to work with you, the leadership, to get off that list. Nobody wants to be number 2 on the high unemployment. However, the challenge is here, and I do feel strongly that we can reach a goal to decrease that unemployment rate.
Well, bring us some accomplishments.
Makes sense.
We look for some numbers, okay? Thank you so much.
We're fortunate that Ms. Putty has worked in the workforce network field in a couple of different positions and have worked. In fact, our last position, she supervised a team that did similar work that she's doing here. So a lot of the people that she otherwise would need to meet, she already knows them all. And so very excited about the work that she's doing, and we'll keep you updated on the work that she's doing.
Well, hold it just a minute. I see some different faces in the audience. Did y'all have anything, anybody in the audience have anything that they want to ask the board?
These are our Edgecombe County Democratic Party
Other than you, other than you. Other than you. Other than you.
We don't want you.
Yeah, other than you. I see some different faces I have not seen. I thought maybe you came for something that had not been addressed, okay?
Well, I didn't have anything to address, but as Viola had mentioned, I am the Edgecombe County Chair, Democratic Chair.
Okay.
And so this is the first chair of the Democratic Party. And it's a pleasure coming to your meeting tonight. I had, because of Dancy filming, I saw your last meeting. And I was interested in, the fire department said no matter the age, I'm 69 years old, that they could use volunteers. So I was trying to get the information to be able to volunteer some of my time, as I've been here for 15 years, but to continue to learn about Edgecombe County.
Tell them your name.
Give us your name, ma'am.
Alfreda Perkins.
Okay.
And this is the Vice Chair.
Abby Lane. Thank you.
And if you want to volunteer regarding fire, that's Mr. Antoine Brown right there. He can make the necessary connection.
Anything from anybody else? Thank you so much. Go ahead, Ms. Evans. I want to get, before that slipped my mind, I want.
Oh, sure, no problem. You have in your agenda tonight my major events and updates, workforce development indicators, TDA financial report. Please put on your calendars January 4th, 7:30 a.m., Farm City Breakfast. It's always a great event. As Mr. Barrett in his presentation mentioned earlier about some funds, you'll see that there's a letter in there. We applied to East Point for their community grant, and we've been given notice of award of $60,000 that will help with purchasing some of that equipment that he mentioned. Update on county line merger really has already been talked about. Mr. Wiggins, you talked about the issue that we had faced regarding possible having to pay money for the those equipment and items purchased with federal funds. That has been resolved. Thank you to our representatives that helped us to address that. And the joint plan was officially submitted to the State Board of Education on November the 13th. So I believe that they may be scheduling a meeting for the superintendents to come and to present the plan before that board. And if so, I find out, I'll let you know. I want to add, not on the agenda here, but I do want to add that filing did open today for candidates interested in open positions. Open today and will close on Friday, December 14th at noon. So, especially for those of you who your seats will come up for re-election next year.
Can you give me a little update on the November 29th county line merger community meeting?
Yes, it was at Parker Middle School, and Dr. Bryan's team did a really good job presenting. This was the series of meetings that they had been going to each of the 4 schools. So this was the last one, basically a community meeting specifically targeted at parents of the students there at Parker that will be transitioning. Of course,
what were their concerns?
I'm sorry, say that.
What were some of their concerns? Or questions? That's what I wanted to know.
I know there weren't a lot of questions. I know there was one question in particular about a program parents' child is in. Was there a similar program available in the Edgecombe schools? I believe it was Spanish immersion program, and they responded yes, they have that at Martin Millennium. And I think there's some general questions or comments about just wanting to make sure that the school system embraces these students and that the community gets involved with helping the students to be successful. Dr. Bryan did have the principal and some of the team from North Edgecombe there because, as was mentioned earlier, those rising 9th graders from Parker will be going to North Edgecombe next fall. And so I think that team did a really good job of talking about their school and the programs that they have available, and they really, I think, went out of their way, and it was very sincere of welcoming, being excited about those students coming to their high school and being prepared to receive them. I believe it was the school counselor, had mentioned that she plans to regularly visit Parker Middle over the next several months just to introduce herself and make herself available. So I thought that overall the meeting went very well.
And I think that was a major part of it. It really, they welcomed the North Edgecombe principal and his management team really did an excellent job of making the parents that were there in the community welcome to North Edgecombe School. And I think the other was questions about the legacy students in terms of they'll be able to stay there, or they have the option of coming to any of the students that want to come, can come to Edgecombe, okay. But I think the key on that is they have to make the decision by, what is it, April, or the 1st of April?
1st of April, yes, sir.
And once they make that decision, or if they don't make the deadline, it's a question of whether they'll be able to go or not, okay. Without paying a tuition, or a, what is it, we call it,
tuition.
It's a tuition, without paying a tuition.
Well, we had no doubt, Commissioner Powell, myself, and Abby Lane, we're proud graduates of North Edgecombe High School, and we knew there would be a welcoming.
Well, we know you all are because you tell us all the time.
That's right.
Okay, we know that you are, but it's a strong alumni base there.
Oh, yeah.
It's a very strong alumni base, and I think and really the school needs the numbers.
Oh, they
Really,
needed
the
it.
school needs those numbers because it's really a small number of students out there, so
My
I
only
think.
concern would be safety, making sure that we have a full-time resource officer, and that officer is at that school every day. Because unless that officer can get to know those students and build a rapport, it's like a revolving door. So that's what.
The resource officer was there also, and I think, anytime it's, the initial phase of it does need monitoring. I would agree, because, anytime we have a number of children coming into a new school, we have these, we do have issues, and I think it does need to be heavily monitored, I would agree, initially, okay. And that would transition, in 4 years, we would have, really, there would be none of our Rocky Mount Edgecombe students, high school students, in the Nash County system, because each year would be gone, because
Did they resolve the school bus issue?
they're still working on that issue in terms of, it's our understanding that they're still trying to trade buses with other units, with other school units, in terms of they can accept the 72 passenger bus?
68 versus 72.
68 buses. Our maintenance facility, school maintenance facility, can only work on the 68 passenger buses, inside, I guess.
Yeah, it
And so they're working to trade those 72 buses with other units that might have 68 passenger buses. But I think they really are working very well together. It was a very smooth transition. Any other questions in reference to any of these? Hearing none, anything from commissioners?
I would just like to invite the board and the audience. The Ebonette Club of Tarboro will be hosting the Martin Luther King Jr. Oratorical Contest on this Thursday, right here in the Carmen Auditorium at 6 p.m. So we would love to have you come and listen to these young people speak on their topic. This is going to be some up-and-coming graduates, because it's for high school seniors. So we appreciate it. And my good pal Ralph said yes to being a judge.
My pleasure.
Any other commissioners? Hearing none, anything from our attorney? At this time, ladies and gentlemen, we're scheduled to go into closed session to discuss economic development and attorney-client privilege. Is there a motion?
So moved.
Second? Questions? All in favor, let it be known by the vote sign aye. Aye. All opposed, thank you all for coming. moving.
It's amazing you brought it up like this. Just take.
And we'll-
Make absolutely sure.
billable hours would have been nice.
No.
Insurance is nice too.
Hey, when he's home, he tell us what to do. Going into a new law firm, he won't be able to work on.
They're on back. They're on now. We're on.
We now stand in open session. Go ahead, Mr. Peters.
Mr. Evans has on here item 17, consideration of approval of the agreement with NC Department of Information Technology and Brightspeed. But I want, before that, suggest a motion based on the board's discussion to rescind a $350,000 appropriation of ARPA funds to CloudWise made at the January 3rd, 2023 meeting to provide the county match to the great grant awardee because the state of North Carolina rescinded its great grant award to CloudWise and it is no longer the grant awardee.
I make that motion.
Second? Questions? All in favor, let it be known by the voting sign of aye.
Aye.
All opposed, so adopted.
Sure. So the second is consideration of approval of the agreement with NCDIT and Brightspeed. I recommend that you approve that as presented.
Second?
Second.
Questions? All in favor, let it be known by the voting sign of aye.
Aye.
All opposed, hearing none, so adopted.
All right. Last, just a reminder that your Christmas dinner will be on the 14th at 6 p.m. at Rocky Mount Event Center. Be on the first floor in the Edgecombe room. They'll have it broken down. We won't be in the big room, but Rocky Mount Event Center, for those of you who are able to.
What day was that?
That's the 14th, next Thursday, the 14th.
At 6 o'clock?
6 o'clock. Yes,
2
sir.
days after your call meeting.
There you go.
Okay. You're right, Audie.
We're earning our keep. Is there anything else to come in open session?
Run out of days.
Well, this ribbon remind us, y'all ain't saying nothing about cutting them ribbons.
When is that? That's,
EV charger, Rocky
Oh,
Mount.
yeah. Edgecombe Community College is installing a charger for electric vehicle.
for the use of the
I
public?
don't know why.
Is it for the use of the public?
Not free, I'm assuming that you'd be some.
Do you pay for, it? Okay, it's really for, well, it's good to have
It's like
one.
fuel.
The town has one for free. I didn't know what,
Is it free?
the town's is free. I was wondering, I think that one, this one might be grant-based where it's free too.
This probably is, well, the county needs
I think this
charging
is free.
station,
Yeah,
yeah,
it'll be free.
because it needs, charging systems within the county, you know.
Yep.
They give out on the highway, they gotta charge somewhere.
Nice to have it in downtown Rocky Mount too.
It would be.
Get them down there eating and using the bathroom.
I think it's coming up, and you know, it's growing, it is growing. A charging station down, it would be good.
Yeah.
I'll mention that to some of the commissioners, some of the city council. Anything that's coming over session? If not, is there a motion to adjourn?
So moved.
Second, questions? All in favor, let it be known by voting sign aye.
Aye.
All opposed, will stand adjourned.
Mr. Davis, event center.
Make sure that they got the event center.
Event center, you don't know what room to first, just first floor.
Okay, I got you.
Right when you walk in there,
Before 10 o'clock tonight?
right when you walk in there, to your left, to the left.
Yes, sir.
From-
Sometimes it's 10:30 or 11 now.